Thanks, Michelle. Thanks, Rachel. Michelle and Lacey and Dr. Lindquist and I are joining this morning to give you an update on where we stand with things in our state related to COVID-19. And I just want to start by, again, welcoming you and thanking you again as our media partners for, as always, continuing to be there for sharing of good information, solid information with our communities. We're going to be doing a little bit shorter of a briefing today. There is a technical issue that we have, which is our slides are not coming up. So we're going to try to do our best to have our slides be on social media. And so if you could refer to social media, it's a little bit of a slightly awkward way of doing this, but we wanted to at least be able to share with you what we think is important for all of you to be aware of. If you can bear with me for just 1 second. Let me also pull up the slides for me. Because they just went away. Okay. All right. So again, what we wanted to do was to just give you an update on where things are, and I'll be speaking first, and then I'll turn it over to Dr. Lindquist. Again, as everybody knows, we have continued to be seeing the impact of BA2 in our state, as we've been seeing across the country. And if our media team can go ahead and put the slide for the BA2 variant on social media, that would be helpful. And as you're looking at this, this is the variant sequencing. And as you'll see from where we were a few weeks ago, when Omicron and BA2 were in essence about 50-50 for the state in terms of proportionality of our COVID positive tests, now we are actually seeing a predominance of BA2 close to, if I can see this correctly, about 90+% of our variant sequencing is now BA2 versus Omicron, which is now under 10%. That's what we're seeing in the state of Washington. Unfortunately, that means that we have been seeing some slight increase in an uptick in cases, but fortunately, we have not been seeing an increase when it comes to severe illness. So let me unpack that for everybody. Again, if social media can go ahead and put the graphic for cases out on social media, I would appreciate it. So as you can see, similar to what we've shown previously, whether it's Dr. Quan Get or Dr. Lindquist have shown, that our, as we've gone through the various waves, we've seen increases in COVID-19 cases. We've been less focused on the cases for a number of reasons, which we will talk about. But what's important here is to just show that, again, we have seen a nice decrease in the number of cases that have been attributed to COVID-19 in our state. That also means that we have now had a downward slope, continue to have a downward slope, and we're starting to see this slight, at the very end of that slope, a slight either flattening or a slight uptick, as I just mentioned. That means that we are monitoring that closely, but at the same time, what we are really monitoring, and if social media can go ahead and send out the hospitalizations graphic, we're really watching hospitalizations. The most important thing for us is the healthcare capacity, and because of all the different various factors that are out there when it comes to counting cases, our focus remains on hospitalizations, which, as you can see in this graphic, remains flat. It has been markedly less than what we were seeing at the peak of Omicron, and we are now nicely seeing hospitalizations continue to come down, which means that we have good capacity in our healthcare system, and that is something that we continue to watch closely. A very similar thing is our curve for deaths in our state, which, as you know, is a lagging indicator, but that also remains stable, and in fact, we've seen a decrease in deaths as well. will. So in summary, we have seen a slight uptick in cases overall, but no change in severe disease related to hospitalizations or deaths. And this is what we are continuing to monitor. As you recall, several weeks ago, we had unveiled our WA Forward plan. This plan, as you know, provided the framework for what we're monitoring and the actions that we are taking. And I look at it as kind of a twofold way of presenting it. One was, what is it that we are doing behind the scenes, and what is it that we are asking the public to do? And that included 3 main priorities as well as 7 commitments. And if you remember, there were 3 buckets of engagement and empowerment was one bucket, prevention, tools, and access was a second bucket, and system readiness, support, and capacity, especially in our healthcare system, was the third bucket. And what this is really important is that as we are seeing these increases, it is likely that we're seeing a combination of some attribution to BA2, as we're seeing in our state, but we're also seeing this likely due to the fact that there has been some relaxing of people wearing masks or being careful with social distancing or all the other measures that they had been taking previously. Those measures naturally, as they come off and you start to see some Omicron/BA2 variant that continues to be circulating in our communities, it is not surprising that you would see some increases in cases. But the other reason that we're de-emphasizing cases is because we've also done a very good job of getting out our at-home tests to the community. And in fact, we have now reached a landmark where we have had 1 million free test kits that have gone out to the community through our Say Yes to COVID test program, which amounts to, as you remember, there were 4 or 5 tests per test kit, and that's just shy of 5 million tests that have been sent out to Washington residents. And I just want to, again, remember our partners who have really helped us with getting these tests out. But as people are at home and they're testing and they're making and taking appropriate action based on the test result, then therefore they're not giving that information or providing that information, or we're not seeing as much of that information in our test counts and our tallies for cases. And again, the reason why we are not as focused on tests, as focused on cases. The other strategy that, as you know, we had unveiled in WA Forward, and Dr. Lindquist can talk about this as well, is related to both sentinel surveillance as well as wastewater surveillance. Again, those providers who are helping us with recognizing what's happening in their clinics, their clinic system, touching base with them, and recognizing whether they're seeing an increase in disease activity or people who are seeking tests, in addition to the wastewater surveillance program that's been set up throughout the state of Washington. So a number of things that we're doing related to WA Forward, but the key piece is that as guidance is evolving, we want to make sure that we're doing everything we can to get that information out to the public. And certainly with that information, we're also recognizing and hoping that the public is going to do what it needs to do in order to continue to use safe and healthy protocols as it protects itself. So again, from our standpoint, this is a really important time for all of us. Now, obviously, we are watching what's happening on a national level, both in terms of BA2, but also with national policy. And I know many of you have been aware of the federal mask policy for public conveyance, and that's not just for airplanes, but also for public transport like buses and trains, et cetera. We're watching what's happening from a national perspective, and our recommendation continues to be for people to one, know that these strategies for keeping safety and health in mind as you're going about your activities really means that we want to make sure people are recognizing that they should continue community keep their masks handy. And when it comes time, and if you're in a confined space and you're around people that you don't know what their vaccine status is, we want to make sure that you are thinking about or considering going ahead and using a mask in those settings so that you can protect yourself and those around you. So with that, I hope I've provided some additional updates on where we are. Again, the good news is that while we've had a slight uptick in cases, hospitalizations, and severe disease has not increased in our state. BA2 remains the predominant variant strain that we're seeing. We continue to follow the framework that we laid out in our WA Forward plan. And again, we're watching what's happening nationally, certainly both with BA2, but also with national policy, and evolving our guidance as appropriate. And with that, I will turn it now to Dr. Lindquist to add some additional insights. Scott?
Yeah, I think you covered everything pretty well. I think the only thing I would say for you all is this is the transition we expected, the transition away from the initial pandemic response to learning to live with COVID. And in this, I very much emphasize what Dr. Shah is saying here. The need to count every case is not realistic, nor is it going to be as useful as it was in the past. Look, when we first had this pandemic, knowing every case was critical. As we've moved our strategies to people testing at home, the strategy really moves around counting every single case. The surveillance system is under construction right now, to be honest, looking at all these things that Dr. Shah just talked about, monitoring what variants are circulating. Certainly, if we had a much more aggressive or deadly variant, we would be looking at cases a lot closer. But with BA2, which is Omicron, we are seeing a fairly mild version of Omicron. And what's more important is our deaths. I mean, we had less than 6 deaths today. That is just territory we have not been in a long time. The best way to really look at this is looking at influenza. We do not count every single case of influenza in this state. It is not required. We still can tell when the flu season is here. We can still understand the severity because we look at the variants of flu. What is reportable for influenza is flu deaths or new variants. Not saying that COVID is going to be exactly like flu, but we are in this transition point of moving away from counting every single case to paying more attention to the variants, to the hospitalizations, to the deaths, and having sentinel providers or testing sites alerting us to, yes, we're seeing an increase in testing, or we're seeing an increase in positivity, or increase in actual cases. So that is the transition we're on, and this is not unexpected, and quite honestly is going to be our path forward with living with COVID. So with that, I turn it back to you, Dr. Shah, and we can answer questions.
Sounds great. Thanks, Dr. Lindquist. And we've got Michelle Roberts and Lacey Fehrenbach on. And Rachel, we'll go ahead and turn it to you for a question. Oh, and it goes without saying, although Dr. Lindquist and I did not mention it, that we also want to remind everybody to get vaccinated and to make sure that if they have been vaccinated, that they get their booster as well. And that is continues to remain a focus for us. And we want to make sure that we remind everybody of that as well. So with that, Rachel, we'll turn it to you.
Thank you, Dr. Shah. Our first question comes from Ryan Harris with Northwest News Radio. Go ahead, Ryan.
Hi, thanks, and good morning, everyone. This one's going to be a little off topic, but as you know, today is April 20th, also known as 420. That means a lot of our cannabis user friends are going to be celebrating today. And I'm wondering, actually, if any of you just have some advice for them. I don't want to put words in your mouth, but I'm going to guess not sharing joints and bongs and that sort of thing might be on the list.
Ryan, thank you. Yes, you know, I do think you've thrown us off with a question comment there, and I would say that, you know, again, regardless of what the activity is or the recreation is, we want to make sure that people keep safety and health in mind, and that we don't forget that we are still in a pandemic, maybe a different phase of the pandemic, but we want to make sure that people are taking whatever actions that they're taking, they're doing so safely. And so, yes, refraining from sharing of items that have been exposed to others, that is absolutely critical to being safe, but also making sure that we're not crowding around each other, and we're making really, at the end of the day, good judgment, using good judgment. And that especially means that if you're in a confined indoor space around other people, that you certainly do everything you can to be safe and social distance, and make sure that you've been vaccinated, and pull up your mask.
All right. Thank you, Dr. Shaw. Did anyone else want to comment on this?
I can just say, whatever reason you're gathering, spring holidays, 420, it's safer to gather outside. Ventilation is less of a concern there, in addition to what Dr. Shaw has shared.
Thank you, Lacey. Let's keep moving. Our next question is from Ariel Dreer with the Spokane Spokesman Review. Go ahead, Ariel.
Thank you. I have two questions this morning. First, are we seeing BA2 increases everywhere statewide, including in Eastern Washington? And then some readers are curious when they should get their fourth booster dose. Now, with BA2 sort of having a larger presence in the community, or later this summer before they're planning on doing more travels? Thank you.
Thanks, Ariel, for that question. I'm actually going to turn that first one over to Dr. Lindquist. And Michelle, why don't we bring you in on that second question about the recommendation on timing of boosters?
Yeah, I mean, the quick answer to this is we're seeing BA2 across the state. The current system for looking at variants is making sure that we're looking not just in the Puget Sound area, that we're getting samples from around the state to evaluate for BA2, and we're seeing it uniformly across the state.
Yeah, on timing for booster doses, second booster doses are now recommended for anyone age 50 and older, or anybody who has a moderate to severe immunocompromising condition of any age. So it's really important to know your risk. We've been talking about that. So if you have any kind of condition that would put you at higher risk for severe outcomes from COVID disease, and we've got lots of great resources if you don't know what types of conditions, but anything that would impair your immune system, other risk factors, including potentially some behaviors like smoking cigarettes or vaping, but lots of good information we have that you should understand what your risk is. It's important for things like we were just talking about, when you should be wearing a mask, but it's also important to make sure you're staying up to date with your booster doses as well. So we do know there is potential for, like we've said, that we're starting to see a small increase in the amount of COVID we have in our state and across the nation. So it's really good to be checking in. How long has it been since your last dose of vaccine? If it's been more than 4 months, it's time to consider getting an additional dose. And if you've not gotten your initial booster dose, we recommend, which is recommended for everybody age 12 and up, it is definitely time to get that dose. These vaccines, we're learning a lot about them in real time. They do wear off over time, the amount of protection, especially against infection. They still produce strong protection against severe outcomes, but it's really one of the best bets, especially while we're still in this pandemic phase, is staying up to date with your number of COVID doses that are recommended for you.
Thanks, Michelle. I think the only other thing, Ariel, that I would add is, and Michelle, you said it, but just to emphasize it, is that, if you're eligible, we also recommend you don't wait, that you go ahead and get your booster now. And so if you've got an activity coming up in a month or 6 weeks from now and thinking, let me wait for just that ideal time 2 weeks prior to that activity, that's really not what we're recommending. We're recommending getting your booster when you're eligible. And that way you have a longer period of time for protection. What you don't want to do is try to time it perfectly and then you for whatever reason have had waning immunity, and now you actually do get COVID-19 while you were waiting for that activity, that ideal time, 6 to 8 weeks from now. And so we recommend you get the booster when you're eligible.
Thank you, Dr. Shah. Our next question comes from Steve McCarran with Como. Go ahead, Steve.
Hi, thanks for taking my question, guys. My question is kind of a multi-pronged question regarding boosters as well. I know the CDC advisory group is meeting right now to talk about the future of COVID-19 boosters, but what about those who are under the age of 50, especially if they're past that 4-month time frame? What should they do? Should they be concerned about reduced immunity? The other main question that I have is do we think boosters will become an annual recommendation, or is it really too soon to tell?
Yeah, great question, Steve. These are all the pieces of information we're learning in real time right now. So it is, if you are under 50, that second booster dose is recommended only if you have a moderate to severe immunocompromising condition. So not everybody is recommended to get a second booster dose. There's a lot of information coming on this, and we're still learning a lot more. I expect that it's likely additional booster doses will be recommended over time, but we really are going to follow the lead of the FDA and the CDC on that. And the manufacturers are doing a lot more of their continuation of their clinical trials to understand what is that right interval and when may additional booster doses be needed. They're also looking at the options around booster doses for with new variant specific vaccines. So both, we've got the current vaccines, but they are doing research and clinical trials on looking at booster doses that are specific to Omicron. And so that could potentially offer more protection. We expect to have that information in late summer or early fall, and that will help chart the course forward. And we're really glad that our partners at the FDA and the CDC, you mentioned their meeting today, are continuing to really look at the comprehensive science around this, and as the manufacturers give them more information from the studies they're doing to help really guide the recommendations going forward. I think it's really important for all of us right now, regardless of whether or not you're recommended for a booster or not. One, to make sure you've gotten your first booster for everybody who's age 12 and up, and that's 5 months after your second dose or your last dose of vaccine. That's really critical. Right now, we know about 58% of our population is up who could be eligible for a booster dose has gotten it. So there still is a lot of people out there who need to get their booster dose of vaccine. That's going to really be your best protection against infection and to continue the strong protection against severe outcomes of this disease. And then also the other behaviors. Vaccine is one piece of what we need people doing, but continuing to making sure you're taking other precautions like gathering outside when you can, watching your social distance, and wearing a mask when you're in crowded settings. It's all of these things, as outlined in our Walk Forward plan, that are important to maximizing your prevention, your protection against COVID-19.
Steve, would you like to ask a follow-up question?
Yes, I'm just curious about, do we think that boosters are going to become an annual recommendation, or is it too soon to tell?
Yeah, Michelle, I'll let you chime in as well. I think it's too soon to tell, but I think the thoughts that we've had in the public health community is that this is the direction that it's going likely to be, is that there will be some regular boosting that will be required over time. We just don't know what that's going to look like. And certainly a lot of that is also going to depend on what we see related to COVID-19 and its transmission over time, and where we'll be next year, where we'll be the following year, et cetera, et cetera. Michelle?
Yeah, I think you answered that just exactly how I was a little bit. I think it's likely too early to tell for sure. And then I think also a piece of this is what is going to be the recommendations during a pandemic. Well, we're still working on what's higher levels of disease happening, and then what may be longer term recommendations. So a lot to still come as we learn more about the course of the pandemic and about how the ongoing protection from the vaccines and the ongoing clinical trial research.
All right. Yes. Thank you, Michelle. Our next question comes from Keith Eldridge with Como. Go ahead, Keith.
Hi, thanks for the question. Double boosted here, so that's good. And actually retiring at the end of next week. So this may be my last question for y'all. But given the challenges of not being able to really take a look at cases, how much of a challenge is it going to be to go forward if you're looking at hospitalizations and even deaths to try to get a handle on this? Won't that be, since it's a delay of perhaps 2 weeks, it might be too late to hit off a new surge?
Yeah, thanks, Keith. And I'll tag team this with Dr. Lindquist. Keith, first of all, congratulations on the decision to retire, and I hope you're going to do something fun and not be on our DOH briefings. Although that's a lot of fun too, I'm sure, Keith. That's probably the thing you're going to miss most about your time. But just want to thank you for your spirit and your service throughout your career, and we're going to miss you. So just wanted to say that. From a standpoint, let's be really clear. We are monitoring other factors. Hospitalizations and severe illness is the most important piece that we're looking at, but we're also looking, for outbreaks. We're looking for unusual patterns. And how do you actually determine unusual patterns? Well, you do that by doing what Dr. Lindquist said very, very nicely, which is you set up a robust system of looking, of detection. And that's everything from genotyping and genosequencing, but that also includes wastewater surveillance. It also includes working with select providers, certain providers across the state that we call sentinel providers that will be able to tell us what's happening in their system. And that's really taking all of that information and then making good decisions based on it. So you're right that hospitalizations may lag a bit or severe illness may lag, but we can look at all that with trends, and those trends then allow us to make good decisions in advance. So hopefully that helps. And Scott, I don't know if there's anything you wanted to add in there.
No, I would just say, Keith, I don't just look at the cases. That's the point. Cases are becoming less, the case count is becoming less and less important to me than these other things that Dr. Shah is talking about, like what is the current variant? What percentage is that variant? How is that variant playing out across the US or across the globe? If we were dealing with a very different variant, we would be paying attention more to numbers or cases. But when things become very common, so things like influenza, things like rotavirus, other things, it's not like we don't look at trends, but we don't count every single case because the value of counting them is not there. That energy is much better spent on things like sentinel providers, genotyping, looking at some of our biggest testing centers in the state. What is their real-time trend? So I think we'll be ahead of the trend by looking at these sentinel areas rather than counting every case that, quite frankly, it's such a common infection now. People aren't reporting every case. Focusing on to those folks that test positive, that they know to isolate so that they don't expose other people. They know that there are treatments out there for COVID at this point, things like Paxlovid, and moving this back into the arena of our healthcare providers. So, at some point when disease is as common as COVID is right now, which is one of the most common respiratory viruses in our community, we need to start normalizing this within the healthcare system. So providers are talking to people that aren't vaccinated, not just relying on state messaging to get vaccinated, although we still are doing that. Having that discussion with your provider, having a provider test you, and the minute they test you, being able to turn around and offer you antiviral treatments right there. That's the model of shifting rather than just being in this pandemic response of counting cases. That's the best way to just give you our current thinking on this.
I just wanted to jump in and congratulate Keith on a successful career and thank him for his coverage of the pandemic. I remember very early on interviews with him in his home. So just wanted to offer my congratulations and gratitude as well.
Thank you, Lacey, and congratulations, Keith. Our next question comes from Nicole Jennings with Cairo News Radio. Go ahead, Nicole.
Good morning, everyone. I understand why we're not focusing so much on the cases as we are on hospitalizations and deaths now, but nevertheless, we are seeing this uptick, and other parts of the world, even other parts of our country, have started to bring back some restrictions. What would it take for us to start bringing back some of those things?
Well, I think a few things. One, as Dr. Lindquist just mentioned, Nicole, that we're looking at everything, but what we want to do is to keep relative focus on what we think is most important. So at the same time as we were seeing an uptick in cases, we had some check-ins with our Sentinel providers, and we started to also recognize that they were seeing some increases in their, in what was happening in their clinic system as well. So it's just a combination of things. But the good news that we were also recognizing is that we were not seeing severe illness, both because we're seeing what's happening with BA2 across the country, across the globe, but also our experience here in Washington. So it's not that we aren't looking at everything, it's that what we're really focusing on is, well, what is BA2 meaning? And what right now BA2 means is that, yes, we have an infectiousness, but we're not seeing severe illness. And so that is really important. We want to certainly prevent people from getting COVID in the first place. That's also obviously important. But what's critically important is making sure that people don't get severe disease and wind up in the hospital. And that's why we're really focusing very much on what are those strategies that people need to continue to keep in mind to be safe, even during, as Scott mentioned, during this interim period of inflection, if you will. And that means that, there are a lot of strategies that we continue to have, which is recommendations for people. But when you say requirements, right now, we do not see any information or any evidence that pushes us into the place where we need to require those interventions, because we believe that, again, we're watching closely that right now the severe illness is just not being seen. So Scott, I don't know if you want to add anything, or Lacey on top of that, but just wanted to recognize that we continue to monitor, but we're not seeing anything that's pushed us into making requirements a part of our strategy right now.
Yeah, I would say it's kind of the opposite at this point. We're seeing decreasing hospitalizations, decreasing deaths, despite a predominance of BA2. So there really is not a big driver for saying that we have such severe disease and taxation on the healthcare system that we need to implement anything. But there is a work group that is pulling together local health as well as state health to really look and say, what in this new era is our metric for really sounding the alarm for mandating things like masks? But I want to be really clear that if anyone is worried about BA2 or about COVID, they know what to do. Number one, optimize your vaccine strategy. So if you're not vaccinated, get vaccinated. If you are vaccinated, make sure you're got your maximum recommendations of boosters. Number two, optimize your respiratory protection. Even though there isn't a mask mandate right now, I think it's wise. And I personally myself wear a mask when I go into the grocery store or the hardware store, and I optimize it with a KN95. Okay, so it's not a loose fitting mask. When I see patients, I wear a fit tested N95. So we're still requiring in my clinical setting that providers are wearing masks. So that's number two. It also means improving your ventilation. So that may mean being outdoors, it may be windows open, it may make sure that you have 12 air exchanges an hour type situation for the building you're in. Number three is really maximizing your use of testing. So if you have symptoms, you should be testing, whether you do it at home or in a clinic. You should know your status if you're having symptoms. And if you're positive, be really clear what to do. You need to isolate. You don't go to work. You don't go to school. And anyone that's been exposed needs to be on alert. And the fourth thing is really optimizing your distancing. So for me, that means I'm not going to big crowded events right now. Yes, it's a mild increase in cases, but all four of these things, none of them perfect. All four of these things are tried and true measures that we all know what to do. And now is the time to continue to do them.
Great, thank you, Dr. Lindquist. Our next question is from Kate Walters with KUOW Public Radio. Go ahead, Kate.
Hi, thanks all for doing the briefing. We really appreciate it. And Keith, congratulations to you on your retirement. Dr. Lindquist, I think you kind of just did what I was going to ask there, but I wanted to just go back to the masking rules on public transportation since this week that was struck down. You've talked about people masking if they're in confined spaces around people they don't know the vaccination status, but could you just be a little more blunt about what your recommendation is on buses, trains, planes for people at this point in time?
I think that was to you. Yeah.
Yeah. You want me to do it, or are you going to take this?
I'll let you take it and I'll add to it. How's that?
Okay. Yep.
Because I have a feeling we're going to say about the same thing. So.
Yeah. I mean, the most direct answer is we adhere to federal laws around what is mandated and what's not. But we still recommend masks, even though it's not mandated. So for me, when I get on the ferry, public transport, right? It's not going to be a requirement. A lot of people aren't wearing masks on the ferry, but I personally am still doing that. But I'm also vaccinated, I'm boosted, I'm masking, I'm not going upstairs on the ferry around a lot of people. I'm either staying on the car or out on the deck. And quite frankly, I'm still relying on testing. I test myself if I have any symptoms, and I test myself every week in clinic before I see patients. So the answer is yes, we respect the national guidance. We essentially have said, respect the rules of the room that you are in. That still applies, but we still feel the need is good for masks, and you should always have a mask on hand.
And I would, you asked the question about, sort of being blunt about what our recommendation is. Our recommendation has not changed. We know that masks work. We know that all these other strategies work, and we want to make sure that people are using them. What we are saying, though, is that there are not requirements for these, so people are going to have to really make good decisions based on both their own risk and also their tolerance of risk, right? So if I have a certain condition and I am having to travel, I'm gonna think about that condition and making sure that I'm taking all the safety precautions as I'm making that trip. If I don't have those, that kind of a condition and I'm taking a trip, I'm still going to consider the fact that I'm in an environment that's a confined space. Now, Scott mentioned, for example, a ferry. When you're up on a deck and no one else is around, and you're looking out at the incredible mountains or the water, you may make a decision at that point not to wear the mask. But if you're inside and you've got other people around you and you're concerned about either them or you, that you should have your mask and pull it up. And that's really what we're saying, and we've been saying throughout as our WA Forward plan, is to continue to give people information and let them make good decisions, and hopefully they will make decisions that are not just about the activity, but also about safety and health as well. And so Scott and I and all of us on this briefing come at it the same way. These are not requirements, but we're asking people to use good judgment.
Thank you, Dr. Shah. Our next question is from Elise Takahama with the Seattle Times. Go ahead, Elise.
Hi, good morning. Thanks for doing this. I'm wondering if maybe Dr. Shah or Dr. Lindquist could talk a little bit more specifically about how the state's wastewater surveillance system is working from both the DOH and CDC standpoint. And then kind of a piggyback to that is, now that we're seeing small increases in cases statewide, could you say whether the wastewater data had provided any signs that that was coming?
Lisa, we had a little trouble hearing you. Was the entirety of both questions around wastewater?
Yeah, sorry about that. The second one was just about whether that data had provided any signs prior to this small uptick in cases.
Yeah, Dr. Lindquist, feel free to jump in on this one. I think that we've got to be very mindful that wastewater surveillance is a promising emerging way to detect disease activity and trends. And the way I look at it is, you don't see it as much the trees in a forest, but you're really looking at the forest itself. And that's what our biodetection methods are really very much focused on, or what are the trees doing in that? What's the forest looking like when you don't actually know specifically the trees? And what that means is that in the case of wastewater surveillance, you don't know exactly specifically who the individual or individuals are that may be contributing to increased transmission or increased collection in that wastewater, but you're seeing the trends of that area or that geographic, either a community or that geographic area, jurisdiction that's showing an increase. So the grain of salt is that you have to use it with other tools so that you can complement everything together. This is not only relying on wastewater as a standalone tool, it's utilizing wastewater in addition to what else we're seeing. And as we get more and more experience with wastewater, now it's been used for other infectious agents as well, but as we use this for COVID-19, we're learning more about how it can be used and how best it can be used and how it can potentially predict the activity, transmission activity within a certain area or community. So again, a lot that's evolving with wastewater technologies just in and of itself. Scott, I'm going to turn to you about, I know that we are with a combination with CDC's wastewater setup in Washington, but also some of the work that we're doing. I wanted to just focus on, we had seen some signals related to wastewater prior to seeing the true increases. And again, the increases are very slight on cases, none on hospitalization. So I just want to make sure to reframe. But just talking through, I don't believe the wastewater trends continued. I thought it was a signal at one point in time. So maybe you can help with that.
Yeah, no, I think you've explained it well. I mean, this is cutting edge technology that we're just getting on the front line of and getting experience. So while we did have some peaks, unfortunately, you see peaks when there's excessive rainwater and excessive flow through sewage treatment facilities. So trying to sort that out and knowing what these signals mean, I don't think we've got a good enough handle on it. I think it's a great question. I'm asking it of our team once a week. I have not had anything from wastewater signal completely change the way I'm approaching COVID. It's promising. Ask us this question in 6 months to a year, and we'll have a much better answer for it and experience and trends with it. But we are right at the front end of this. We're one of the states that's really adopting this new technology.
And the only other thing I would add is that as long as Scott mentioned, as long as this technology shows not just promise, but it actually shows utility, we will continue to be one of the leading states when it comes to employing this kind of technology, because that's what we have done throughout this pandemic. Is we've looked at the latest technologies, the latest strategies, and adopted them so that they will help us for predictive analytics moving forward. So that's the one assurance we have. But again, it's a little too soon to say that we can put everything in the bucket of wastewater surveillance.
Thank you, Dr. Shah. Our next question comes from Annette Carey of the Tri-City Herald. Go ahead, Annette.
Hi, I wanted to know a little bit more about if trends are uniform across the state, east, west, urban, rural, in things like new case rates, deaths, hospitalizations.
I can answer that one pretty quickly. There is a difference between Eastern Washington and Western Washington, and these are broad strokes. You can't really clump all of Eastern Washington together, but yeah, the case rates are being seen more in the Puget Sound area than they are on the eastern side of the state. Hospitalizations tend to be a little bit lower right now in the eastern side of the state. There's a lot of confounding to this over time because a lot of hospitalizations for complex medical conditions usually come to Puget Sound area hospitals. That's like university settings that increase that number here. So there is a natural difference across the state. We are not seeing the same increase in cases on the eastern side as we are on the western.
All right, well, this concludes our question and answer segment of the briefing. And now we'll go to Secretary Shaw for closing remarks.
Again, just want to thank everybody for being here today. I also want to, again, congratulate Keith on his upcoming retirement, and best of luck to you. And thank you for continuing to serve Washingtonians. I want to thank all of our my colleagues who have been here today. And I think the key message is we remain vigilant on watching what's happening with BA2 in particular in our state. The fact is that we have been seeing some slight uptick in cases, but as we have talked about at length here, our focus remains on severe illness, and we have not seen an increase in that. In fact, we're seeing, again, continued good news when it comes to both hospitalizations and deaths. And so we do want to recommend and remind everybody to stay focused on their health and safety as well as those around them. Get vaccinated, get boosted if you haven't already. Keep your mask handy for those especially indoor crowded settings. And also make sure that you use testing, especially at-home testing capabilities in a way that's going to allow you to make good decisions. I want to thank our media partners again. Thank you everyone for joining us today, and we'll continue to update. And as you know, we're doing this briefing on an ad hoc basis. We are not planning on having another briefing in April, unless obviously something changes. Our plan is to have another briefing at some point in May. So with that, just want to say thank you again, and I'll turn it back to you, Rachel, to close.
Thank you, Dr. Shaw. This concludes today's media availability. I'd like to thank our panelists for their time today and TVW for hosting today's live stream and archives of past briefings. Thanks, everybody. Take care.